Welcome, everyone. My name is Francesca Mangano, and I'm a Master's in Social Work intern on the Crossroads for Hope team. I'm joined here by Kyle Jackham, one of our licensed social workers, and of course, our presenters today, Mary Garden, a hospice care coordinator, and Robbie, a hospice social worker, both at Accent Care in St. Peter's University Hospital. I'm so excited to welcome you to the second session of our three-part Planning for Peace of Mind educational series. The purpose of this program as a whole is to bring awareness to the available resources for advanced planning, equip individuals with tools for communicating their end-of-life wishes, and empower all people to take control of their own future, health, and well-being. Now, we each have our own unique experiences, wishes, and beliefs around end of life. So this is by no means a one-size-fits-all process. But nonetheless, everyone deserves the right to self-determination, autonomy, and dignity. And as an organization, we believe that by destigmatizing these difficult conversations and providing some information about both the legal and medical processes, we can bring you one step closer to fulfilling those fundamental rights. Please note that at the end of our three-part series, we'll be sending out recordings of the presentations to all individuals registered, along with a Planning for Peace of Mind resource guide. And this guide will offer some helpful information and handouts on the topics discussed throughout the next few weeks. To those of you who may not be familiar with our organization, Crossroads for Hope is an independent 501c3 nonprofit organization located in Bedminster, New Jersey. Our network of support embraces all people touched by cancer, the diagnosed, and their loved ones, providing access to resources and evidence-based programs of support, education, well-being, and hope, all offered free of charge. Our vision is to be a safe space to turn to, first, for restoring one's whole being and improve the life of people with cancer and their families beyond the diagnosis. Now, this session of our series is in partnership with Accent Care through St. Peter's University Hospital. And today we'll be focusing on advanced directives, medical orders such as POLST, and what it means to choose a healthcare proxy. Throughout the presentation and afterwards, feel free to drop any questions or comments you have in the Q&A box or chat box, and we will be sure to get to them at the end of the presentation. Thank you so much for joining us today. Mary and Robbie, I will hand it off to you.
Welcome, everybody. I'm Mary Garden. I have the privilege of working for a hospice and palliative care organization, Accent Care. We're a national company, and just recently this year, we've been able to partner with other services where we can provide home care, personal care, palliative care, and hospice now. So that's a benefit. My coworker have a lot of experience just working with patients and families, just answering questions and being an advocate for our patients and families and a resource as to options so that they can make the best decision for themselves or their loved one. A lot of conversation, like Kyle was just sharing about advanced care planning comes into place proactively even before somebody may need it. Typically, there's a lot of conversation with patients and families just with regard to what is advanced care planning and what entail comes into that. I think my goal for today would be just to have a discussion around that so that you can make an informed decision and then for future put something in place as far as a formal document so everybody is aware of what your wishes would be at present. Advanced care planning is a process. It's not necessarily an event or a document. Like I said, it's a process of planning for the future in your medical care in the event that you're unable to make your own decisions. During this time, we're just going to discuss options, typically having the conversation An advance directive, if anybody doesn't know, it's basically just a written statement of your wishes regarding your medical treatment. It's made to ensure that your wishes are carried out should you be unable to communicate them yourself to your clinical team. We use the term advanced care planning. Part of that is, like I said, just having that initial discussion on what your wishes are. I encourage all of you just to, if you're unsure at this point what your wishes may be, have conversations with clinical experts, social workers, patient, family, your loved ones, nurses, physicians, with regard to what your thoughts are. A lot goes into if you're wishing to have, should something happen, are you interested in having CPR? Conversation happens around artificial nutrition, helping with breathing, which is breathing tubes. These are all things that come into play when patients and families come into the hospital. And Robbie, you could probably speak to this too. We have many families that don't have those conversations prior to an event happening. And we're trying to get that information from the family as quickly as we can while they're in this type of setting. Robbie, do you have anything to add as far as the advanced directives or advanced care planning that you speak to families about?
Yes, so I would like to start by making it clear that the post is actually a physician order. So the post, POLST, actually stands for portable medical order. So it serves as a physician order and it has to be respected, honored, whether you have it at home or at a doctor office or just at a hospital in the chart. So it's a serious form, that takes place when the patient is no longer able to verbally, clearly communicate their end of life wishes as far as aggressive treatments, in aggressive end of life decisions, or it does not have to be end of life, just decisions during care. Okay, so just for us in general, we all should have a form, not necessarily wait till the minute that we are unconscious. Okay, so because we lead and we make decisions throughout life, we make decisions about what college I'm going to go to, what job I'm going to do, how many kids I'm going to have, then I think it's important to also make decisions about, well, do I want to have a feeding tube when I'm no longer able to swallow my food by mouth? So that's what the goal of the post is for us to make decisions and not have family members making decisions on our behalf. And Mary, we sit with many family members that feel guilty making those end of life decisions when there is an emergency, right?
Mm-hmm. The other thing I see often, I had 2 families this week. Those families who had proactively had these conversations with their loved ones when it wasn't needed, it could be, the holidays are coming up. It's just a very light conversation with regards to goals of care. It's such a gift. I had 2 families this week and it was the burden was off the sons and the wife because it was clear, it was discussed, they knew exactly what to do, they knew exactly what the wishes were. It was just an easier part of a very hard process. So that's just something to consider, you know. It really is. It's a gift that you could give your spouse, your children, that they already know before the time is that they need to act on something like that. Hit upon with this series is about, you know, a healthcare proxy. What is that? Choosing a healthcare representative. A healthcare representative, also known as a healthcare proxy, or your healthcare agent. I use the word advocate a lot. Power of attorney for healthcare, durable power of attorney for healthcare, or a surrogate decision maker. This is the person that you designate to speak on your behalf if you cannot make your own healthcare decisions. So I would encourage everybody, again, give that some thought. Sometimes, and I've seen your closest, your spouse may not be that person. Think about who you're going to choose that's going to be able to carry out your wishes. If you were unable to speak due to your illness, your proxy, your advocate, they would do that. They would advocate for you, your wishes. And most commonly, the situation occurs either because you're not alert and oriented, you're unresponsive, unconscious, or because your mental state is such that you're not able to make a decision. So this person, you should confirm prior to appointing someone as your proxy that he or she will be willing and able to carry out your wishes. Again, this is all conversation around being proactive for yourself so that your wishes, your values are carried out. Should you not be able to communicate that to your clinical team? Do you have anything, Robbie, that you'd like to add to that?
Yeah, as far as the health proxy, just as a reminder, a health proxy does not necessarily has to be your next of kin or your legal spouse. It can be your friend that you trust. It can be the chaplain at the church that you go to. It can be anyone who's willing and that you have trust that they will actually honor your medical wishes.
Mhm.
You don't need a legal lawyer to complete the health proxy form. It's something that you can complete with your social worker or with your nurse. There is no lawyer involved.
And a lot of these forms are available on the internet. They're very accessible nowadays. I'll give Kyle, will link those. I would gather resources that any of the viewers can tap into and review. Another just pearl that we pick up from doing this is, should you have any document that you have in place, I would encourage everybody, just take a screenshot, have it on your phone. I have so many families that come in and they don't have the documents with them, but they do have the document and they could quickly just email it or forward it through their phone. It's a very quick and efficient way to always have that on your person. Yeah. I'm trying to think. Is there anything else as for we've touched upon advanced directives, we've touched upon the medical orders, which would be a pulse, and we've touched upon a healthcare proxy.
How about a DNR, Mary? Did you touch
on that?
Yes, because that's a separate form, and a lot of families find it kind of less complicated to complete a DNR versus the green post, you know?
Can you talk in detail about what that is?
So the DNR is stands for the do not resuscitate order. The forms are very accessible at your doctor's office. We saw them at assisted living, nursing homes, hospitals. And that's for those who want to peacefully die at peace and not take the chance of being resuscitated, and which can cause fractions and more complications, ICU admissions at the hospital. So it's very clear, and it's actually part of the post. You can complete it with the assistance of your nurse practitioner or doctor, and they usually give you a copy to keep at home, and a copy is at the charts at the doctor office or hospital.
And Robbie, these documents that we're talking about, they can be modified. So decision can be made to have it written a certain way in January, and events could change, or your thought process, something could change, and it could be changed again to reflect something different. So if you're thinking that, oh, I'm gonna complete this document and have it, then I'm locked in, you're not. They're very modifiable.
Absolutely, and we've seen it where we have patients with DNR and they change their mind and they revoke the DNR and they request to be resuscitated. We also seen the opposite, where we do a lot of education for a family to complete a DNR and they insist on doing resuscitation, but then when they see the decline and they see the changes in how fragile the patient is, they decide, no, I don't want I don't want CPR at this time. So yes, you can change it.
Yeah. I'm going to go back to what I originally said. The best time to decide is now, when it's not needed. It's really to think about what your goals are, what your wishes are going to be. Once you have taken time to do that, and then to secondary have that discussion with your loved ones. And then that third step would be simply to just document it. And any one of us could assist you with putting pen to paper of your wishes. And that's really the long and the short of just documenting what your thoughts are should something happen in the future.